I'm Jonathan Nelson for the New Jersey Academy of Family Physicians with a special report on Medicare. This program provides health coverage for 43 million elderly and disabled Americans, some of whom may soon find it increasingly difficult to get the care they need. The Centers for Medicare and Medicaid Services have proposed a 15% cut in physician payments over the next 2 years. What's worse, the Medicare Board of Trustees projects that if the current payment formula isn't fixed, physician fees will be cut by about 5% each year until 2016. That's a 40% cut over 9 years. In a program that frequently doesn't pay enough to cover the cost of providing services, these cuts will surely force many physicians to limit the number of Medicare patients they can afford to see.
A decrease in the payment for Medicare would have a negative impact on all my patients and in my community as well. I'm worried that some physicians would close their panels to future Medicare patients, and as the population gets older, and that's a larger percentage, there will be less of those patients getting access to medical care, primary medical care.
If we were to lose 15% on every visit with those Medicare patients, we would start to become extremely strapped for cash flow. And so we would have to consider whether we'd continue to participate with Medicare or seek out some other sources of revenue.
The proposed cuts are the result of a flawed payment formula designed to control Medicare spending and utilization by restricting payments to physicians. The Sustainable Growth Rate, or SGR, sets an annual spending target for physician services. If spending exceeds the target for the year, Medicare reduces physician fees to make up the difference. But cutting physician fees doesn't decrease patients' demand for services. And as the nation's aging baby boomers enter retirement age, there's no question that demand is on the climb.
Cost factors in our business are real. We have to pay electricity, we have to pay rent, we have to pay our staff, we have to have a whole bunch of gas, electricity, and so on. The other problem in all of this is that because of the healthcare system has caused us such decrease in reimbursements that we're unable at times to meet these costs. And these increased in costs that are not at any value at all to the healthcare system are a tremendous detriment to the quality of care that patients get.
We're trying to figure out how are we going to give the staff that's been there for 10 years, doing a really good job, well, gee, the little tiny raise that we can afford to give them without, us taking a big pay cut to accommodate that.
Since most health plans base their fee schedules on Medicare, these cuts will drive down physician payments by private insurers as well.
If Medicare does come through with the 12–15% cut that we're hearing that they may come, that is definitely going to hurt us because, yes, the other insurance companies do use that as a benchmark. In fact, some of them actually undercut it and try to pay us lower than that, which is one of the arguments that we're having right now with 2 insurance companies.
Several recent studies have shown that in areas where primary care physicians provide the majority of care, Medicare patients receive higher quality care and better outcomes at a lower cost, potentially saving billions of dollars in the Medicare program. That's why your Academy is working together with AAFP to make sure Congress fixes Medicare's flawed payment system so that America's senior citizens have access to the care they need.
Obviously, we're going to have to make a fix if we want family physicians to actually be able to afford to take Medicare patients. We don't want to see people finding that when they go to a doctor that there's actually an office policy now because those reimbursements are inadequate. And I'm particularly concerned about family physicians because there's a lot of talk now about a medical home and what an advantage that is for people to have their family physician, someone that they know a relationship with. And yet, if we don't reimburse properly, there's not going to be any time at all for those physicians to spend with people, even if they do take them.
We all like to be known as someone, as people, as members of Congress who pay attention to the needs of our constituents, and nothing could be more important, or very few things could be more important than access to family physicians.
For more on what your Academy is doing for you and to learn how you can get involved in the fight for family medicine, log on to the Academy's website at www.njafp.org. Reporting for the New Jersey Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in action.